Thank you very much, Assemblywoman Rubio. The information that you provided so far has actually been very interesting and helpful. I want to talk to you a little bit about COVID-19, the coronavirus. Now, again, I have been an emergency room physician for over 40 years, and so I have seen a number of epidemics in the past, and I've even seen one pandemic, and that pandemic was cholera. That was a few years ago. Now, we didn't have much of the pandemic in the United States because our sanitation is so good. Probably the worst epidemic I saw was actually swine flu, and many thousands of people did die, actually. Now, what I'm going to talk about today, I want to just warn you, things will change as times go on and more studies come by. And some of you will remember from the early part of this disease, they were telling us that we didn't need to wear masks. And now, of course, everybody knows you need to wear masks. And they told us there was no human-to-human transfer of the disease, and of course, that's not true. And they told us that the disease was not aerosolized, that was not, the particles weren't up in the air, and you couldn't breathe them in and get sick, and of course, that's not true either. So there may be some more things that are going to change. So the question about this disease is, how did this come about, for heaven's sakes? We see coronaviruses every year in the winter, and it's like a common flu-like syndrome. But what happens is this: there are many viruses that circulate within animals, and eventually, occasionally, they will mutate, they will change, and then they will jump to humans. This has happened before with SARS, bird flu, swine flu, so this happens from time to time. And this is not completely different from that, in that this probably happened either with some experimentation in a lab in Wuhan, China, with the coronavirus, or perhaps it came out of one of the wet markets in China, in Wuhan, where they were selling bats and other animals that are unusual for us to sell and eat in this country. So this is brand new, and there are some things about it that are very different. One thing is it is very, very contagious. And because it is so contagious, what's even worse is there is no, we call it herd immunity to this disease. You know, when the flu comes, a lot of times you don't see this many people getting sick. And the reason is because we have vaccines that you can take at the early part of the year, and in many cases people have had the same disease before, and so they're immune to getting it, and therefore there are a lot of people that can't get sick. So we call this herd immunity. And many people don't even know that they have the disease under normal circumstances with the flu. But it's even worse in this particular case because it's so contagious. We have a lot of people walking around that have the disease and have no symptoms whatsoever. This is common with viruses. You might remember that from time to time we'll have a West Nile outbreak in the United States, especially in California, and occasionally somebody will die. But the vast majority of people that have West Nile get the disease, don't even know they have it. So that's happening also with this particular disease. So, number one, it's different because it's contagious, very contagious, and there's no herd immunity. And the second thing is that it's very unusual because it causes something called a cytokine storm in some people, and we don't know why it happens in some people and not in other people. This is an autoimmune response. That is, your body makes antibodies against yourself. And in particular in the lungs, it fills up the little air sacs with fluid, so people have trouble breathing. And these are the people that usually end up on ventilators. Now, where in heaven's name did the drug hydroxychloroquine and chloroquine come into the picture here? And the answer is that these drugs are used very commonly for many, many years, and they're relatively safe. And they're used for malaria and for rheumatoid arthritis. And rheumatoid arthritis is the connection, because rheumatoid arthritis is an autoimmune disease. Your body makes its antibodies against your own joint cartilage and causes arthritis. Now, there are other drugs that are in everyday use that also blunt the autoimmune response. One, for example, that many people have heard of is colchicine. It's used for gout. And in fact, right now, there have been over 40 drugs that have been tested in laboratories, and they do blunt the autoimmune response that gives you the cytokine storm. They're all doing it in various amounts. but there's about 10 of them that seem to do it a little bit more than the others, and these are seriously being studied right now. The drug that is most likely to come out of this, in my opinion, is remdesivir, and that is an antiviral drug, and it seems to be working out well in most of the studies where it is being done. The best answer for this problem is to have a vaccine. Now the problem is, vaccines usually take a long time to develop. The fastest one I've ever heard of was 4 years. Now they are trying really hard to increase the speed at which this is done, and hopefully they can get one out in a year or a year and a half. But I have to tell you, I'm a little concerned that that's really not very accurate information. So I just need to tell you this about this situation. This virus is going to be here for a while. We're just going to have to get used to living with it. At this point, it's safe to go down to the emergency room because we've been dealing with this for a couple of months now. If you come down to the emergency room and if you have a fever or if you have symptoms of this disease, we're going to treat you in the tent, and we will not mix you in with the general population in the emergency room. And in fact, if you're so sick you have to be admitted to the hospital outside of this tent, in the outside tent, we will move you directly into the hospital, and you will not go through the emergency room. So there have been people that have been afraid to come down to the emergency room thus far, and we've had people that were so concerned, like with chest pain, that they didn't come to the emergency room, and then they ended up having a cardiac arrest outside in the public and dying. And there's no reason to be panicked about this. You can go to the emergency room now, and we are aware of what's happening. And in fact, at Arcadia Methodist, one of my 6 hospitals, my biggest hospital, I spoke to the nursing director a couple of days ago in the emergency room, and I said, gee, now that we've had 80 or so cases of this disease come through this emergency room tent, has anybody gotten sick, any of our staff? Our nurses, our doctors, our clerks, anyone? The answer is no. Nobody's gotten it, and that's because we all know what to do. We wear masks, we wear gowns, we wear gloves, we do everything we do to keep ourselves safe. So since this thing is going to be here for a while, we're going to have a new normal. We need to be safe. We need to have social distancing. We need to wear masks. We need gloves. We need to use some common sense here. And this will be here for a while, but we can be safe, and everything will work out in the end. So thank you very, very much, Assemblywoman Rubio, for allowing me to give you my interpretation of what's going on in the world of coronavirus.